Hi, Erin. Welcome to the Fit Cookie Nutrition Podcast. I'm so excited to have you.
Thank you for having me, Holly. It's my pleasure.
Yes, I am just really pumped to have you here to help me tackle this topic. I went through an entire episode by myself on hypothalamic amenorrhea, giving our listeners a little bit of a rundown on some background with it. But then as I kept talking, I kept realizing how deep of a topic it was and that it would be super helpful to have someone like you come help me tackle it. So today we're going to talk a little bit more about hypothalamic amenorrhea and like kind of how it can be combined with and influenced with gut health. So before we get into that, I want you to give a little background on yourself so you can tell us who you are, what you do, and where you're from.
Absolutely. Can we agree to call it HA instead of having to say out hypothalamic amenorrhea?
Yes.
Okay, so I'm going to refer to it as HA from now on when I talk about it. But as Holly said, my name is Erin Kenny, and I am a registered dietitian, a holistic cannabis practitioner, and I am the founder of Nutrition Rewired, which is a Boston-based private practice where I provide in-person as well as nutrition counseling, where I do meal planning with clients and just coaching individuals to help them achieve optimal physical, mental, and spiritual well-being. And I specifically focus on gut health and sports nutrition, providing personal approaches. And as Holly said, there is a strong link between HA and digestive issues. Both because people experience HA, they might have digestive issues, and then also vice versa. So I'm actually really excited to talk about this.
Yeah, absolutely. And you are like the gut health guru when it comes to all of this. So I'm excited to have your insight on this. And before we kind of dive into HA, which I'm excited that we're calling it that because that's a mouthful, can you kind of describe a little bit more like your specific, like personal background with your own gut health and your running as well? Because I know there's a deeper story there, but just to give a little bit of a rundown for our listeners.
Sure, absolutely. So I grew up an athlete, played soccer and basketball. Honestly, basketball, I would say, is probably my favorite sport to play, probably for the fact that it's more fast paced and you get the contact side of things. But so I grew up a full-time athlete. And as soon as I decided to go to college, I knew that I didn't want to pursue, sports, including basketball and soccer, as a full-time career. And so I was transitioning into this place where I, wanted to stay physically fit. It was a huge part of my routine growing up. And I knew how to run, generally speaking. And I decided to pick up running. And I went to school in New Hampshire, which is where Holly's from. And it was a beautiful campus. So I really fell in love with it because it was a really great outlet for me for my mental health. And, my story starts off being really beautiful, where it was a great tool for me. I was, in shape and really loved the benefits of it. But I did get to a point where it became an unhealthy habit. And I was using it for, my anxiety. There was a big transition phase for me in college where some people will say, college was the happiest years of their lives. I personally was really struggling with my mental health and, turned to running in an unhealthy way, which then led to multiple injuries. I spent a lot of time in physical therapy. And, years later, after working on improving my gut health and all the things that went along with overtraining and underfueling, I now love running again, but I did have a few years there where my relationship with running was a very complex one, and I had lost the joy of running, which I am so glad that I have found it again because it can be a great thing when used appropriately. So that's kind of just a short little snippet of my journey.
Yeah, thank you for telling us that. And like you said, running is one of those sports, and any sport I think is like this, but for you to love it and for it to love you back, like sometimes they're two different things, and like to have them happen together is awesome. And I know I have a pretty similar story in terms of like just the structure of how my running has gone. It's been positive, and then there's been times where it's more negative and then positive again. And I think a lot of people can relate to that, which is why I'm excited to dive into this topic. So actually, on that note, you mentioned, running kind of became a little bit more of a crutch for you, and in terms of your mental health, ended up involving a lot more negative mental health impacts, like in injuries and gut health issues. So just to kind of go into our first part of HA and how running can affect that. So in what ways does running affect gut health? So there's kind of probably some positives, so let's start there before we go into the negatives.
Yes, I always like to start with the positives.
Yeah.
So we know from research that physical activity in general, especially exercise that releases endorphins, has a very positive impact on the composition of our gut microbiome. And, the gut microbiome is a hot topic right now for very good reason. We know that it's linked to, pretty much every aspect of our health. And so one of the many positives of physical activity is that it can shift the bacteria in our gut towards a more positive environment. When done in the right amounts and with the proper fueling, it can be an incredible benefit. Now, also tapping into the mental health benefits, we know that our brain and our gut are directly connected. So if you're, using exercise and running to relieve stress, then that's also going to help with reducing inflammation and improving overall inflammation and, the gut, and really promoting a positive experience for our gut bacteria.
Mm-hmm. Yeah. And I know with some of my clients too, like a lot of them will describe like, oh, if I run or if I do X, workout in the morning, like then I'm more regular, I experience better regularity. It gets things moving. I think, you could probably speak to this too, just from personal experience, but sometimes if you like are heading to a race or something and you're anticipating a performance happening, whether it's on the basketball court or on the roads, you're like, all right, let's get things moving. And, it can kind of help make that more of a routine. I think bodies like consistent routines a lot. But I know there's so much, depth to like how it can like alter our gut microbiome. Like certain bacteria in there can, lead to us having better mental health, better like genetic expression. And that's just like such a deep topic. So, I think in terms of exercise, a lot of it is positive. We're not saying, hey, stop exercising at all in this podcast, but there are definitely some considerations and consequences to when it becomes exercising too much that, is relative to the person. Everybody can exercise and handle a different amount of exercise, but also exercising without the proper fuel, like you said. So on that note too, let's dive into some of the more like consequential things that running can have on gut health and how HA fits into all of this. So from our first episode, we dove into 3 common misconceptions about HA and also some strategies to take to start helping with that. And I didn't really dive too deep into the gut health aspect. So to give some background first, like describe a few things that can happen once we're experiencing like overtraining and underfueling and HA in terms of GI distress, symptoms, when this can happen around that.
Yeah, I think one thing to just create an awareness around, which Holly just stated, which is the obvious, that when you're running, you're moving things along. When you jump up and down, or if you think about shaking a cup with water in it, the water starts to move up and down as you're going, and you can think of that scenario happening in your gut when you're running. And so, in terms of proper fueling, and gut health and stuff like that, it's important that, we're meeting, number one is our energy needs. That's incredibly important to fuel the actual performance. But a lot of the common issues, now the question that you asked was kind of what are some of the ways that gut health issues show up with underfueling? Is that right?
Right. Yeah. Like, how does it show up? Because, I think we've developed the background to the point where we have HA. So, like, what gut symptoms,
Yeah.
could be present because of that?
So there are the more obvious ones that people will oftentimes, come to me saying, I've got gas, bloating, distension, constipation, and usually those things are pretty obviously impacting their performance, whether it's having to run to the bathroom mid-run or, just feeling like very heavy during the run. And most people aren't aware of what healthy bowel movements should even look like. I could talk about that all day too, but then food sensitivities, if you're under fueling or you have HA, which usually go hand in hand, you'll hear people, people will come to me and say, okay, I feel like I can't eat eggs anymore. I feel like, gluten's upsetting me. I feel like I can't eat, grains or things like that. That's a big, sign of some sort of gut issue, because when we have any sort of inflammation going on in the gut, then that is what creates what we call intestinal hyperpermeability. And it sounds fancy, but what it really means for those who are listening is, you've got your digestive tract, and then you've got these cells lining your digestive tract. And so when things become very inflamed, these junctions along the edges of your GI tract become loose, and things that shouldn't be crossing through the GI tract into the blood actually do cross through, and that causes your body to react. So you can kind of think of it like, having an open wound on your skin. There's going to be things that can get into that wound when you have an opening there. And so that's going to cause your body to react to certain foods that might not be happening. You might not be reacting to those foods if your gut health is healthy. Low appetite can be a very common one, that you have some sort of stress going on in your gut. Skin issues. A lot of people don't think about having skin issues like acne and psoriasis and eczema, things like that. But it's people, we want to think more outside of than just the obvious symptoms of gas, bloating, and, diarrhea, things like that.
Yeah, and I like that you touched upon like the obvious, because I'm sure you hear about this all the time in your practice since you specialize in gut health. But, a lot of the time, some of those other symptoms that we think have nothing to do with our gut have everything to do with our gut, like the acne, some of the hormonal imbalances. And I love that you kind of take a root cause approach to figuring out, what we can do to help improve gut health. And kind of all of these other things are just going to they're going to be, a side effect essentially of having negative or positive gut health. So like at what point, would these symptoms be coming up in a runner experiencing HA in your experience? Like, would it be, after you've started missing periods? Could it be happening before, or could it be like years after you've even maybe tried to get your period back? Like, what do you see in terms of like the timeline of it?
Yeah, I mean, HA is typically accompanied by, either some sort of physiological stress, underfueling, overtraining. So you don't have to have a missing period or irregular menstrual cycle to experience these issues. So, someone might still have, a regular period. They might still be bleeding every month. However, they might, have PMS symptoms like the acne or cravings and things like that. And even, like I said, just under fueling, that's going to result in, you might have some sort of thyroid issues showing up, like maybe low T3 because you're not eating enough carbohydrates. So it can really occur in any stage of either the progression to, having HA or, during and even after, because, afterwards, after maybe you recover and you restore your period, all of my clients who have restored their periods see that once they do, their gut issues are significantly better. But it can take time. And, a lot of that is because your gut is a tissue. It takes time to repair. And a lot of it too is getting your hormones balanced again. Yes. So once you're balancing your hormones coming out of a state of energy deficiency or overtraining, We can have these swings in, metabolism and, hormones like leptin. And so it can take some time, which is very individualized for each person, to come back and find some normalization in digestive symptoms or those other symptoms that we, discussed earlier in terms of seeing full recovery. And also, the mental side of things, because there's often, some sort of issue underlying there, and dealing with and working through those emotional issues can also take some time. Even once your body is feeling safe and your gut is feeling safe, it can take some time to get to a better place mentally as well.
I love that. And I love that you talked about the time that it can take. Like, even if on paper, your period's coming more regularly, maybe you've implemented some things to help, which we'll talk about in a bit, but you can still be experiencing symptoms. And I know for a lot of people that can be really discouraging and make you like second guess everything you're doing. Right. So like, if you had to put, I know you don't have a crystal ball, but well, you're pretty good, but you don't have a crystal ball. But if you had to put like a timeline on like, what it takes to kind of help improve your gut symptoms, especially if we're talking about someone who's had a really long period of time with HA where they've really, kind of dug themselves into a deep hole and are trying to come back out on the other side. Like, are you talking like, a 2-week like elimination diet and you'll be great? You talking like, a couple months? Or you talking years and years?
I'm talking if your thyroid's normal, if all your thyroid levels come back normal, if your period is restored and you've gone, I would give it at least 2 to 3 months of, 3 months is usually my gold standard. You have 3 months, you've had a normal cycle, you don't have, these crazy PMS symptoms. Like I said, everything else is normal. Your nutrient levels are replete, and everything else, clinically is good. You should see benefits right away. And that doesn't, it might not require any sort of, elimination diet. Elimination diets in this case would be used just to reduce inflammation. And again, we're going to seal up, think about that gut. We're going to seal up the gut. We're going to kind of put some, some cement in there, if you will, to kind of heal what's going on in the gut. And then as soon as that happens, we can introduce all the foods back in, we can resume training in an appropriate way. As long as we're properly fueling, then, your gut is a pretty smart tissue in including your body in general. And so you can see resolve from this in as short as, 2 to 3 months.
Mm-hmm. I love that. And I like that you keep addressing too, like the gut is a tissue, like it kind of functions like all the other tissues in your body. I think a lot of us think it's some like vague, like weird black hole that we just like put things into. And like, we know that there's bacteria in there, and we know that they're good for us, but it can get kind of confusing. It can get confusing when you're looking at the research too, but it is a tissue and it functions like one. So if it's injured, essentially, we have to heal it. It might have to wear a cast, so to speak, for a couple of weeks. And then, we can use it again in a strategic way. So if our listeners are experiencing any of those GI symptoms or any of the other symptoms too that we talked about, like acne, PMS, kind of some of those hormonal symptoms, what are a few key things that they should do to start making progress? So, I kind of put in like, should they do just an elimination diet for 2 weeks and then all their problems will be fixed? Like, where's a good starting point, and what do you usually do with your clients?
So the first thing, and this is because this has become much more common, I'm seeing this a lot more in my practice, is to address any sort of dysbiosis. Mm-hmm. And for the listeners, what that means is, there is an imbalance in bacteria in the gut. So we normally have what we call good, bad, and neutral bacteria, and they're really all supposed to be there because they all serve a purpose. But what happens is when things become imbalance is when we start to have, potential for bacterial overgrowth in our small intestine, which in that case would need and require a specific intervention to eradicate and get rid of that bacteria. So addressing any underlying dysbiosis or small intestinal bacterial overgrowth or true clinical issues would be number one. Now, if we don't have anything going on there, then the first thing would be to make sure that you are eating enough, which sounds very obvious, but again, the gut is a tissue. So you can think of your gut like a bicep. If you go to work your bicep and you don't have enough energy in there, it's going to break down that bicep and it's not going to repair itself, meaning you're not going to be able to flex and, show off your guns. So make sure that you're eating enough, especially carbohydrates. Again, those are going to help rebuild that tissue, but it's also really important for your thyroid function. And your gut is producing, certain hormones all the time, melatonin, serotonin, and as well as the conversion of thyroid hormones. So if your carbohydrates are too low, which is very common, especially among athletes, then the production of T3 is going to be impaired. That's going to slow your gut down. You're going to experience constipation, what have you. So make sure you're eating enough carbohydrates. I think those would really be my two biggest things, is making sure you're addressing any sort of dysbiosis and make sure that you're eating enough of the right things and balancing the bacteria in your gut.
Yeah, and those, kind of are really good places to start, and like to individualize it more, like, when you were saying address any dysbiosis that's there, if there's small intestinal bacterial overgrowth or SIBO, as a lot of people might have heard of it, doing specific things to work through that. Like, at what point could someone say, okay, like I've tried some of that, or I've tried to improve just like the mindfulness around eating meals. I'm not rushing through all my meals. I'm chewing my food. I'm putting some effort into this, and it's still persisting. I'm still having issues with digestion, or I feel like I have food intolerances. Like, what would you say would be some red flags to look for if someone's thinking that?
Yeah, I think, in this case, I would say working with a professional is really going to be your best bet, because it's really important that you're having an outside perspective of someone who has real knowledge in this area, because otherwise you're likely just going to be treating symptoms. So, okay, I'm constipated or I'm having diarrhea, and, we're not looking at the bigger picture oftentimes. And even myself, I would hire out for any sort of issue that I'm having, because I know that my lens is much too narrow to focus in on and see the big picture. So like you mentioned, even the mindful eating stuff, but there's so many other things, like we mentioned, the thyroid and nutrient deficiencies and all that really all play a role into our gut health. You need someone who's going to be able to create a plan that's systematic. Oftentimes, clients will say, well, I tried a probiotic or I tried an elimination diet, and those just aren't really appropriate if they're not in the right context. So for instance, if you have small intestinal bacterial overgrowth, just taking an over-the-counter, probiotic could make your symptoms worse. And then, you say, okay, well, screw that. That didn't work for me. Whereas, if you had SIBO, you implement an antimicrobial where, maybe we do rifaximin as an antibiotic, or we do oil of oregano and go the herbal route. Then we add in the probiotics, and then we, maybe try an elimination diet with a reintroduction. So the sequence of all of the steps that you take will determine your success, and it requires knowledge, patience, and planning.
Knowledge, patience, and planning. I like that trio. I think a lot of the times we're lacking in the patience department, or just a good place to start kind of department. So, if someone, like you mentioned, has SIBO and they go to the store and they buy a probiotic and it makes the symptoms worse, like, what other like examples could you give where someone might need to, kind of do something more specific, like, certain gut conditions that maybe are misdiagnosed, or, when would it be more of a red flag if there is a true food intolerance that's there?
Yeah, I mean, if you're having like a food allergy reaction where your throat is closing up, or you are developing, like dizziness or numbness in your limbs, things like that, where it's impacting your nervous system, you should go see an allergist first and foremost, because food allergy testing is a certain type of antibody testing, a certain type of allergy testing, whereas food sensitivity testing is not a great measure, and it's not addressing the root cause. There's no science to back it up. So you really want to, go meet, if you're having, for instance, black colored stools or blood in your stools, or you're severely dehydrated and you're dizzy and feeling fatigued all the time, and your heart rate is becoming to a point where it's concerning, then you should go seek medical attention. Absolutely, get replenished, whether it's electrolytes, have a GI workup where they're going to be doing a colonoscopy. It's more often than not that people will go to a GI specialist, and they'll do the full workup, and they'll say, well, there's nothing there. And that's when they usually come to me and say, well, my doctor says everything's fine. So if everything's fine there, which it's important to look at, if you did have some sort of, something truly going on in your gut that was maybe like a hiatal hernia, or like we mentioned, a bacterial overgrowth, or some sort of parasitic infection, things like that they need clinical attention that you're going to need to go in for. So, it's after that I would say, when they say everything looks good from that standpoint, that you would go meet with a dietitian and get that looked at from a dietary perspective.
Yeah. And I love that, because it is important, if you're really worried, to rule out some of those things, and getting that kind of clean bill of their symptoms, but we don't know what's wrong with you. Having sometimes knowing what isn't the problem can be helpful, because then we can identify, where to start, and what's safe to do in practice as dietitians. And, some of the things too, a lot of the times elimination diets, because you got like a food sensitivity test done, may not be appropriate. So I think you mentioned a couple topics ago, when people come to you and they have trouble digesting like gluten, or they have trouble with eggs, or they have trouble with various proteins, what is your experience with like food sensitivity testing, and someone also coming to you and saying, I have sensitivities to like 25 different foods. What do I do?
Mm-hmm.
Why are you finding those testings to be problematic?
So I think first and foremost, to understand why things are being flagged on a food sensitivity test is important. And I like to explain this using like an example of someone showing up at your front door. And this could also have nuances to it, but just bear with me. So somebody shows up to your door, and, maybe you're not super excited that they're there or whatever, but you're going to open the door, right? You're going to go acknowledge that they're there, maybe have your kid go deal with it and be like, oh, mom's not home, whatever, but you're acknowledging that they're there. And so it's similar with the body with food sensitivities. So your body is going to acknowledge that a food is there, but that's not necessarily a bad thing. So just because you're having a reaction to a food doesn't necessarily mean that it's causing inflammation in the body. So yes, it's measuring the acknowledgement of a food in the body that you're eating and digesting, which is often why you'll find when you do a food sensitivity test, it comes back as flagging the foods that you eat a lot of. Coincidence? I think so. And then what happens is people start to cut these foods out, and they say, well, it's causing inflammation, I'm reacting to them. Meanwhile, the foods on this list they'll eat and they don't feel bad, but then they'll say, well, I eat dairy and I know I feel bad, but that didn't come up on my food sensitivity test. But still, it's this idea that these tests are superior. So then they'll go follow a restrictive diet. They'll cut out salmon, and they'll cut out egg whites, and they'll cut out gluten. And what happens is we're now fueling the fire for inflammation in the body, because now we're under fueling. And to couple that, we're now creating an unhealthy relationship with these foods, where we're afraid to eat these foods because we're under the impression that our body is negatively reacting to them. So it's really this cascade of events where we don't often ever see benefits coming out of reducing these foods. What I personally believe benefits is that when people do these tests, they start to pay more attention to what they're eating. They try to be mindful, they're exercising, and that's why people might see the benefits. But there is no evidence to suggest that food sensitivity testing is going to make your gut feel any better, or you as a person, or reduce inflammation. An elimination diet is the gold standard, and to listen to your body and what symptoms you're having.
I love that summary, and I love the door metaphor. That's really helpful. And like in terms of those sensitivity tests, part of what I find troubling with them, which you touched on too, is if you're taking one, you're likely inflamed, because otherwise you wouldn't care what foods you're sensitive to. And if you're inflamed, this thing is going to come back with a lot more markers on it because you're inflamed, and it's not necessarily because of any of the foods it flags, because it's just acknowledging that they're there. And a lot of the times it's not, giving you much insight to what the root cause of your inflammation is. So for something like HA, where we have someone who is, experiencing stress in some way, a lot of the times it's coming from underfueling or overtraining, or a combination of the two. And that can be for a lot of different reasons, which I explained a little bit in part one. But I think a lot of the time, some of the reason is like intentional underfueling. There's a lot of information out there about like carbohydrates, and like, let's not eat that much of them and they're bad. And, do you feel like someone who maybe is in that mindset already, do you feel like adding something like a food sensitivity test to them could be even more damaging to their relationship with food?
Oh yeah. Yeah. And I see this so often where, when and some people, they might not even intentionally be underfueling. It's just that, they're so caught up in just, kind of that feeling of feeling light, and, that maybe fear of, having a poor run if they eat too much, or, maybe it's subtle and they don't even realize it so much, but absolutely, these tests fuel the fire in terms of an unhealthy relationship with food, and then also, more disordered eating habits. So it's more of a reason to restrict, and that is a problem in this case, especially because underfueling is typically the root cause and the stress on the body.
Yeah, absolutely. And I think it's really important, that if we are trying like a strategic, way to improve someone's diet to support gut healing, it's important to do it in a way that doesn't hinder their relationship with food, which I know is a very slippery slope sometimes.
And with my clients, and I know you have the same approach, Holly, is, what can we add in? What can we add into the system to help repair it, help make it feel safe? Because as you mentioned, when the gut feels safe and when the tissue is healthy, then it's not going to react. Think of it, and I know these analogies are just, they keep coming, but think of it like a little kid who hasn't napped. For instance, like if you do anything to that kid, if you ask them to take the trash, even if you say like, I love you, they're just going to be irritable and cranky, and they're going to react to anything that you say. Your gut is the same way. So if you're napped, if you're well fed, if you're well slept, all of those things, your gut is not going to react to all of these foods. So there's an example for this too, is, my athletes who are maybe like, Olympic training athletes are going into some pretty heavy, intense training cycles. And with that being said, that's just the nature of their profession. And oftentimes, they can't rest. They have to push through it. And that's what we work with. And I meet the clients where they are. And oftentimes we might do a low FODMAP diet temporarily. Why? Because FODMAPs are poorly digested if you have a stress gut. So we might treat a symptom in that case to help lower the inflammation in the gut and help them, get through their training cycle, feel really good, absorb the nutrients that they can absorb, maybe supplement with a multivitamin, really high quality multivitamin, maybe probiotic, get them through that with the intention of getting them out of that cycle, getting them rested and refueled, and repairing the gut. So, that's just an example of something that I'll do with clients that, again, we might be treating a symptom, but the goal ultimately is rehealing and reintroducing those foods.
I love that example too, because like you said, that's an extreme example, right? You're talking about an Olympic high level elite athlete who maybe has this as part of their career and livelihood. And like, you know, you're not going to change that situation. You're not going to say, hey, stop training for the Olympics. You know, if you can treat the symptom temporarily with the goal of it's a training cycle, eventually they'll come into an off season, you know, that's really important. And I think, you know, part of what we're talking about too, you know, if you're listening, is it's important to have off seasons. It's definitely important to give yourself that break to rest, especially if we're not elite level athletes, because we do this for fun. You know, and we should be paying attention to that. So I love that you gave that example there. And actually on that too, not to open, like we need to do another episode, but not to open an even bigger can of worms, you know, a lot of the times with HA, it can be related to the person's, you know, history, and it can also be related to maybe their history with birth control, and using hormonal birth control contraceptives like the pill or the IUD or the implant patch, you know, whatever your choice of method was. And I know that's a huge topic, but a lot of the times hormonal birth control can even deplete certain nutrients. So it's important to go through a period of replacing them, you know, if you're staying on the pill or if you're choosing to come off. Do you have like, and I know it's a huge topic, but do you have like anything to add in terms of if, you know, you're also on some sort of hormonal contraception, if you're throwing that into this mix as well?
Yeah, I think it's important to look at the reason why we went on the contraceptive to begin with. If it's for birth control, and your hormones were normal prior to going on it, that's, you know, that's a situation where you might have had balanced hormones. Okay, that's great. Now, if you started taking the pill because you had an underlying hormonal imbalance, which isn't being addressed, I mean, the gut and hormones are directly connected. There's research that shows that estrogen is protective of our gut tissue. So if you have low body fat and don't have enough estrogen in your body, there's so much that goes into that. But if I have a client who is on birth control, like you mentioned, because it depletes certain vitamins, we're going to be getting them on a nice high quality multivitamin. We're going to be assisting their gut as best as possible to manage any sort of dysbiosis, because you know, birth control can exacerbate leaky gut, which is what we've talked about prior in this episode about, you know, creating inflammation in the gut and then having an imbalance of that bacteria, especially if we're adding in these artificial hormones. Any sort of hormonal imbalance to begin with can lead to this dysbiosis, but we would support that as best as we can while the client is on birth control, you know, whether it be through probiotics or, you know, following a specific diet to eradicate the overgrowth of some bacteria, and just really meeting the client where they are to figure out how we can best, you know, calm that gut and just make it so that it's absorbing and utilizing, right? Because people often say you are what you eat, you are what you absorb, and you need to absorb all of the nutrients that are important for hormones and overall health and performance in order to actually, you know, perform optimally as a human being. So it's important to remember that your gut is where we're absorbing these nutrients that are required for optimal hormone balance, performance, health, everything.
Yeah. And that's where too, sometimes, you know, I know you're very similar minded to me. Like we use that food forward approach. Like we want to incorporate what can we add to your diet, you know, to help your specific situation. But sometimes, you know, if there's like malabsorption happening, you know, it can be important to supplement, especially if you're already knowing that you're like depleted in a specific nutrient. And that's where, again, you know, supplements, there's a lot of them out there. So it's definitely important to work with someone so that you pick the right one. And so you pick the right one that has like a high quality supplement. So, you know, and I also wanted to mention too, you know, in terms of, you know, talking about birth control and, you know, your gut health and reasons that you may or may not be on it in the first part of the Hypothalamic Amenorrhea series, I touched on kind of how the pill works, and that taking it is not just going to fix your problems if you have lost a period. And it's pretty similar to your gut health. Like if you have poor gut health because of hormonal imbalances or different stressors, going on the pill isn't going to fix your problems. Sometimes it can make them worse. So it's important, to be really open and communicate that with your healthcare professionals and with your dietitian if you're working with one, because they are all related, even though I think a lot of us don't think of them being related at all.
Yeah, it's true. And, another tie in here, because I know that, for athletes, the worst thing is to be injured, right? Nobody wants to be injured. I can count, how many times I was just bawling my eyes out in college when running was taken away from me through injury. And it was awful. You are sidelined from the one thing that maybe is bringing you joy, or the one thing that's your stress release. And not that that's healthy either. That's obviously something that I had to address, was finding other outlets for mental health. But, you love the sport. And so, injury should be a big motivation to take care of your gut and take care of your hormones, because if they are related, which they are, especially with HA, if we're not absorbing those nutrients, and then we're not absorbing calcium, we're not adequate vitamin D, we don't have enough calories to repair bone, we can't forget about that. We can't forget about the bone health side of things, because it's not sexy now for people who are not, osteoporosis prone, which surprisingly a lot of females in their 20s can be, and they don't even know it if they are, having a missing period or just underfueling for prolonged periods of time. But it should be something to think about, especially from a standpoint of injury, because I see so often reoccurrent fractures as one of the main causes of underfueling and poor gut health, because we're not absorbing the nutrients, we're not fueling properly to repair the systems of the body, including the bones. And that's just going to cause you to be out of the sport that you love for longer. And so it's at that point where you say, at what cost is it that I'm underfueling? Is it the way that I look? Is it fueled by, stress or mental health condition? What is the fuel for why I'm making these decisions, and why I'm allowing my body to, be in this state where eventually it's going to, not be life-giving anymore, but it's going to be life-taking.
Yeah. And I think it's important because, like you said, a lot of people will think, oh, like bone health, I don't currently have a fracture, so I must be fine. And, we're kind of like jumping up and down with our hands in the air, exclamation points everywhere, because it is important. And like, you have control over it now, before you're injured. That's like where you can really turn it around quickly and avoid that big injury. And from my personal training perspective, building your fitness as a runner, oftentimes, all the stars need to align perfectly for your race day to go well, especially in something like a marathon. Your training has to have gone well. So, to really make that more consistent, we need to put blocks of training next to each other and build off of that training. And it's really hard to do that when you keep getting re-injured. So, prioritizing your nutrition, prioritizing your gut health, and prioritizing, like you said, why we're in this state of underfueling, if that's the case, is really important to prevent, losing a sport that you love down the road. Because like you said, being injured is the worst. And we're trying to help you prevent that.
Yeah. And I want to also be very transparent here that I am speaking to you now as a dietitian who helps, clients find optimal health. But I personally had lost my period for several years and was on birth control for 10 years. I eventually got a DEXA scan and saw that my bone density was actually less than optimal and had taken a hit because of the underfueling and the overtraining that I was doing. And none of those things, you can't take birth control to protect your bones. It's research is proven. Birth control will not protect your bones. You cannot take calcium and vitamin D, high levels of supplements to protect your bones. fuel your body and heal your gut. That will protect your bones. And as Holly said, this is the prime time to do it, depending on how old you are. But as you get older, it becomes very difficult, if not impossible, to build up that bone. So you really, really want to care about it now, because down the road, you're going to run into some serious issues. And like I said, I've been there. And, in my mindset then, you couldn't have pulled me out of it. But that DEXA scan, that's what woke me up and made me realize this is serious. And this is not just a body image under fueling issue. This is truly impacting my body on a deeper level than I could have ever imagined.
Yeah, and it's such a young age too, right? Like when you're in college. And me too. I mean, my experience is similar. I think that's why we're both so passionate about it. I also ironically was going to school for dietetics, and my internship, I was learning about this, and that was when I lost my period because I was stressed out of my mind. I was commuting, like working 12 hours a day, stress of school and everything. And on top of that, my only outlet for stress relief was running. And I would get up at 4 a.m. and do my long runs. And then I would drive from Dover, New Hampshire to Concord, New Hampshire, and work there for 10 hours and then drive home. Wasn't eating enough. And, that's when that kind of happened to me. And my wake up call was when my internship was over, because it stopped and this only carried on for a few months. I felt like I needed to sleep for like 14 hours a day. I couldn't get off the couch. My period did come back eventually, but I was like, oh my gosh, had that gone on for more months or even years. And I also have a birth control story. I'd also been on it for about 10 years. It's a lot, and it's really highly impactful. So we're just trying to bring awareness to do something about it now while you're still on both feet, and while you can, especially, if you're in your 20s, 30s, you're still very much, in the knowledge is power, and you can almost reverse it. But once you are a little bit older, it becomes a lot harder or even impossible.
We're like the moms that are talking to the kids who want you to do differently than what we did, because we've gone through it. So, help us help you. And, we